Hey everyone, so if you're a pitcher that's dealing with an arm injury or any other injury throughout your body that has led to you being shut down from throwing, whether that is a low-grade forearm flexor strain or something as severe as Tommy John or labrum repair surgery, you're likely shut down from throwing right now, and you're going to be looking at a gradual build-up to work on getting back to pitching in games. So I want to talk today about what a good rehab, return to throwing, and return to competition program looks like. So when we're talking about getting back to throwing, there's a couple different criteria that we need. I'm not going to go too much into that for today's video specifically, but we need to make sure we have optimal strength and range of motion in both our shoulder and elbow. There's different ways we go about testing that. And we want to make sure that you have good exposure to an upper body plyometric program, so the use of medicine ball and plyo ball drills, both two-handed and single arm variations. And depending on the injury or surgery that you had, you might do that for as few as 1 to 2 weeks, or you might be doing it for as long as 4 to 6 weeks, depending on the surgery you have. So now more so going into the rehab throwing progression. Again, a lot of it is going to be very dependent on the injury or surgery that you had. So again, a lower grade forearm flexor strain is going to be getting back to throwing and pitching a lot quicker than Tommy John. For Tommy John surgery, we know you're likely not going to get back to pitching in games any sooner than a year out. It's generally 12 to 16, sometimes up to 18 months for guys to get back to pitching, back to full pitching in games after that surgery. So even though the length is different for a lot of these programs, the overall variables and considerations remain the same throughout most of them. So one of the first variables that we look at is distance. Depending on the age and intensity of the thrower, I might start as low as 30 feet. Again, this is maybe more in the youth thrower, like 10 to 12 or 13 years old, or I might start near 45 feet. So that's going to be typically where a lot of guys start, is at that 45 feet. One of the questions that I typically ask as part of our intake process when I have someone come in the first time is, how many throws do they typically take per session, including warm-up throws, for a normal day of throwing? And this is tough for a lot of guys to figure out. Some guys, it might be maybe closer to 50, maybe closer to 60, sometimes upways of 80. I generally like to program, I think that's 60 to 65 total number of throws, maybe a little bit higher depending on the level of the player. Tends to be a goal of what I'm working towards throughout that entire rehab progression. So volume of throws, that plays a role as well. We want to make sure that we're getting a gradual increase in volume throughout that entire rehab progression. So for those first couple weeks or first couple months of rehab throwing progression, it's going to include throwing on every other day. So more so about 3 times a week, so like Monday, Wednesday, Friday. That way we're allowing for optimal recovery on those non-throwing days, and typically try to give guys the weekend off from throwing just as a way to kind of fully prepare for the next week of throwing. So again, going back to distance, if we're starting at 45 feet, might have a gradual progression from 45 feet to 60 feet, 75 feet, 90 feet, 105 feet. Typically 120 feet is where I will cap guys. 120 to 135 feet is when you start to get mechanics similar to what is being performed on the mound. So that's typically where I will have guys kind of build up to. The next part of that is the frequency. So again, we've talked about we're starting to throw every other day. After we've built up a good base and maybe throwing every other day up to 105, 120 feet, again, it just depends on the thrower, how far we're going to back them up. Then we start to work on, all right, let's get them throwing on back-to-back days. So 2 days in a row. Then we're building up to 3 days in a row. Then we're maybe working on getting up to 5 days of throwing per week. And typically when we get to that throwing 5 days per week is when we look into getting flat ground work in. And when I talk about flat ground work, I mean it more so you'll back up to 100, you'll back your throws up to 120 feet, get a certain number of prescribed throws in 120 feet, walk back into 60 feet on flat ground, and then you're working on going through your delivery. This should really be the first time you're getting hard throws on a line. And I know there's kind of some different schools of thought in terms of the overall mechanics on flat ground. Does it put more stress on the arm versus we just have guys throw off the bottom of the slope? I think it's very dependent on the situation. You need to be able to modify it based on your specific player. But as a general rule of thumb, I find that it's a good way for guys to start throwing on flat ground. I've just found the minute you put someone on the mound, it is really hard to control that intensity. So we'll go through that flat ground progression, And once they get a flat ground progression, then we start to work into getting off the mound. If in the case of Tommy John or a guy has been down from throwing for a long period of time, we'll start with what we call slope work. So they might throw off the low in the first 1 or 2 bullpens, off the low part of the slope, then off the mid part of the slope, and building up to that full slope height. And just as a reminder, up until this point, we are only throwing fastball. There's no changeup, no breaking ball, off-speed work. It is all fastball up until this point. After we throw those couple slope work sessions and we get to the full slope of the mount, we'll start working on our, really this is a kind of our full mount progression at this point. And we'll start maybe around the 15 to 20 pitch mark, gradually building up over time to about 30 pitches or so. And again, we'll start fastball only for the first 1 or 2 bullpens. And again, that's subjective to the injury or surgery that's going on there. Again, Tommy John, you're gonna have a lot more bullpens in your progression than a lower grade forearm flexor. So you're gonna start with just bullpens that are fastball only, then fastball changeup, and then your last couple bullpens you're working in your off-speed stuff. Now, mind you, before you get to your off-speed stuff in your bullpens, you're gonna probably have some time. You're gonna have some time where you're just working in on flat ground, preparing you for that mound. After you go through your mound progression, now you're gonna start working on facing hitters, whether it's in a simulated game environment or just in traditional live ABs. And again, depending on the injury or surgery, depends on how many live ABs you get. But once you get back to the live ABs and get through that progression, then we work on getting into games. Now for starters, depending on if you're going on most guys going on a 5-day rotation, you're gonna build your game progression off of that. I do not recommend you get right back into throwing 3 to 4 innings right away, especially if you're after surgery, Tommy John, labor repair, anything like that. Starting off at 1 inning is the right spot to kind of just get you back into that game competition. We really just need to work on monitoring the intensity up until that point. Anytime we have big spikes in intensity or volume before we get back into games, or anytime during that process, that's typically where re-injuries happen. So after we go through that, the game progression is going to look different from a starter versus a reliever. A starter, you're building up maybe over that 5-day routine, versus a reliever, you are likely going to be throwing more frequently during the week. So not only do we want to work on throwing more frequently during the weekend games, we also want to get them back to throwing for back-to-back days. So what that might look like is they pitch on one day, 1 inning, then they pitch again 3 to 4, 3 days after that, and then eventually we're starting to work back to throwing on back-to-back days. That's typically the hardest part for relievers to recover from. One other thing I want to touch on in throw programs is the use of radar guns. There's starting to be a lot more use of technology in the world of throwing programs, which I think is a good thing, but it needs to be properly implemented. You do not want to get a radar gun on you right away from the first day of throwing. Velocity is not the goal there. You need to get more of an emphasis on mechanics. I have found with certain guys, the minute you get a radar gun on them, they focus more on the number versus their mechanics. So I just caution with how quickly you implement that into your program. Now, if a guy is really throwing hard on a line on their 3rd day of throwing program and they can't seem to dial it back in, maybe that's the right time to do it. But just be very cautious with it. It becomes very hard for some pitchers to be able to take away the number from just focusing on throwing. There's a lot of benefit to just going out there and throwing. There's going to be part of that process is just figuring out how to throw again. And going off of that, you need to make sure you are working with a qualified pitching coach. While there's a lot of good that we can do in a physical therapy standpoint to make sure you are strong enough, have enough mobility and stability to get in certain positions, when we're talking about putting it all together, you want to make sure you're working with a qualified pitching coach. So that is a general overview of what goes into developing a rehab throwing progression for a pitcher.